Hello, my name is Dr. Dawn Ewing. I'm the Executive Director of the International Academy of Biological Dentistry and Medicine. This is part 7 of Biological Hygiene, and we're talking about clotting disorders and jawbone ischemia, tagging right after learning about what a cavitation is. Here was some research that was done, and hopefully we'll pass on a little more information to you. The purpose of this study is to investigate safe alternatives to the drugs heparin, Coumadin for patients that demonstrate mild ischemia of the jaw as visualized by cavitat imaging, which is a speed of sound photography. Ischemia is defined as poor tissue perfusion of oxygenated blood. There was a grading system used, 0 through 4, discussing the cubes and the color of the cubes, how many of the cubes were in the green. When we're talking about homeostasis, it's the process of blood clotting and the subsequent dissolution of the clot. This involves 4 major events. Vascular constriction, which occurs and limits the flow of blood to the injured area. Platelets becoming activated by thrombin and an aggregate at the site of injury forming a temporary loose platelet plug. A fibrin mesh which entraps the platelet plug to assure stability now that we have a clot. Finally, the clot must be dissolved in order to resume tissue repair. The dissolution of the clot occurs through the action of plasmin. Here's a visual of a blood clot. So pretty I could actually hang it in the office. Hypercoagulation disorders can cause clots to form at any time and lodge anywhere in the body. This could cause a stroke, a heart attack, phlebitis, or even osteonecrosis in a jaw. So different definitions straight from Tabor's. Prothrombin is a chemical substance in the blood that interacts with calcium salts to produce thrombin. Thrombin is an enzyme formed from prothrombin which reacts with soluble fibrinogen, converting it to fibrin. A thrombus is a stationary blood clot obstructing a blood vessel or a cavity in the heart. Thrombolytic pertains to causing the breakup of a thrombus. Fibrin, a protein formed by the action of thrombin on fibrinogen. Fibrinolytic, the action of breaking up fibrin. Plasmin, an endogenously produced fibrinolytic enzyme. Plasminogen, a precursor to plasmin found in many tissues and body fluids. TPA, which is a tissue plasminogen activator. They're released from vascular endothelial cells following an injury. Then they become active and bind to fibrin to digest it. TPAs are drugs used to lyse or break up clots or thrombi. And streptokinase is a plasminogen activator made from Streptococci bacterium. Conventional drugs for therapy usually involve heparin. It's useful as an anticoagulant because it binds to and activates antithrombin 3, which then inactivates factor 10 and inhibits the conversion of prothrombin to thrombin. Heparin also prevents the formation of a stable fibrin clot by inhibiting the activation of the fibrin stabilizing factor. It does not have fibrinolytic activity, therefore, it does not lyse existing clots. Coumadin inhibits coagulation by inhibiting the vitamin K-dependent reactions necessary for the function of thrombin in factors 7, 9, and 10, as well as proteins C and S. It has no effect on the established thrombi, nor does it reduce ischemic tissue damage. The goal is to further prevent extension of the formed clot. Streptokinase and TPA are plasminogen activators, which degrade the fibrin in the clots. And aspirin is an important inhibitor of platelet activation. Contraindications and side effects of using heparin. It requires monitoring of blood coagulation tests, platelet counts, hematocrits, and occult blood in the stool. It should be used with extreme caution in disease states where an increased risk of hemorrhage may occur. The following are a few examples: hypertension, spinal tap, following major surgery of the brain, eye, or spine, hemophilia, ulcers, liver diseases. Many drugs and herbs, as well as over-the-counter items, can affect the reaction of heparin. Tetracycline, nicotine, antihistamines can reduce its effect. Aspirin and ibuprofen may increase its effect. Overdose can cause nosebleeds, blood in the urine or stool, easy bruising, or petechial formations. JAMA, November 2002, indicates use of low-dose heparin may transform a benign fungal infection into a toxic shock-like reaction. Consequently, heparin may exacerbate neurotoxic conditions and increase hypercoagulation by raising the cytokine TNF-alpha. Coumadin is contraindicated in pregnancy because it crosses the placental barrier and may cause fetal hemorrhage. Recent surgery of the eye, brain, or traumatic injury, aneurysm, pericarditis, ulcers, spinal tap, hypertension, known or suspected protein C or S deficiencies, hepatitis, congestive heart failure, or vitamin K deficiency. Anticoagulation therapy with Coumadin may enhance the release of arterial plaques, producing an emboli which can cause purple toe syndrome. Drug interactions may occur with anticonvulsants, antidepressants, antihistamines, antacids, barbiturates, diuretics, anti-anxiety agents, vitamins, and more. Bromelain, daishane, donquai, garlic, ginkgo biloba can increase the effects. CoQ10 and St. John's wort can decrease the effects. More herbs that are contraindicated with Coumadin. Use the PDR for herbs is a good place to find out information. Arnica causes an additive anticoagulation effect. Bilberry causes an increased prothrombin time. Feverfew causes an increased antithrombotic effect. German chamomile causes an increase in prothrombin time. Horse chestnut increases a Coumadin component that may interact with warfarin, aspirin, and other prescription medications with anticoagulant properties. Astragalus causes a potentiation of anticoagulation effects. Cayenne causes an increase in fibrinolytic activity that can cause hypocoagulation. Alternative therapies. Well, less traditional therapies, ones that have actions on platelets. Vitamin E, the action inhibits platelet adhesion and aggregation. Ginkgo biloba contains terpenes that act as PAF inhibitors, but they're contraindicated in hypertension. Perilla oil, high in an EPA and DHA, which reduces platelet activating factors. Ginger, which inhibits the thromboxane A2 to reduce clot formation and increase the prostacyclin, which inhibits abnormal platelet aggregation. Garlic can reduce platelet aggregation. Green tea can inhibit abnormal platelet aggregation. Turmeric can reduce thromboxanes and increase the prostacyclins, which inhibit platelet aggregation. Some things that are actually actions that are fibrinolytic. Proteolytic enzymes like wobazyme or marcozyme or TPP protease or purezyme, when they're taken on an empty stomach, not during a meal, so that means about 2 hours after a meal or an hour before a meal, they're absorbed and carried into the blood and bound to an A2 macroglobulin. Once bound, they hydrolyze protein materials in the blood. Essential fatty acids, which are high in phosphatidylcholine, which reconstitutes membrane fluidity to reduce clumping. Bromelain, which contains a mixture of sulfur-containing proteolytic enzymes from the stem of a pineapple plant, which reduces the fibrinogen. Or lumbricinase, containing Lumbricus rubellus, which is a protease from earthworms. It has a fibrinolytic activity only when in the presence of fibrin, and it reduces excessive bleeding. Nattokinase, or natto, contains the nattokinase derived from an extract of fermented soy cheese, which also has fibrinolytic activity. Let's talk about protease. The proteolytic enzymes bind to serum proteins, particularly the alpha-2 macroglobulin. Their actions are fibrinolytic, reducing the platelet aggregation and reducing excess extravascular proteins. The protease increases the binding of the cytokines, the hormone-like molecules, which increase immune modulation. Protease demonstrates increased tumoricidal activity of polymorphonuclear neutrophils. The nattokinase, on the other hand, research shows one cause for the osteoporosis is lack of vitamin K2. Natto contains vitamin K. Vitamin K is needed for the synthesis of blood clotting factors such as prothrombin, factor 10, factor 11, protein C, and protein S. Bone synthesis also requires higher concentrations of calcium in the plasma. According to disease prevention research, the main plasma MK type, MK7, level of an osteoporosis patient is half that of a patient with osteoporosis. MK7 requires specific organisms and activities for its production. Natto is the only known food that naturally contains MK7. Natto was given to patients with osteoporosis, and every hour the blood was sampled. At the 4th hour, the MK7 concentrations in the plasma increased with ingestion of 100 grams of natto and resulted in a 54-fold statistical increase of MK7 in osteoporosis patients. A 10-gram dosage increased the MK7 levels by 18 times the original level in the plasma, and a 2-gram dose increased the levels by 5 times. Nattokinase properties closely resemble the plasminogen by directly dissolving fibrin. Nattokinase, when we look at the fibrinolytic injections of urokinase, which last 4 to 20 minutes, whereas the nattokinase remains in its activity for 4 to 12 hours. Nattokinase not only digests fibrin, but also the plasmin substrate. Nattokinase contains the isoproban, an antioxidant considered promising in the prevention of prostate and breast cancer. Natto also contains dipicolinate acid, which has an antibacterial effect against harmful intestinal bacteria while increasing the useful flora. Natto contains inhibitors of angiotensin-converting enzyme called ACE, which converts angiotensin 1 to its active form of angiotensin 2. This translates into a lowering effect of both the systolic and the diastolic blood pressure. Additional therapies. Well, Dr. Patricia Kane points out the need for additional support with fatty acid therapy to reconstitute the membrane fluidity. Polyunsaturated lipids high in phosphatidylcholine help prevent undesirable clumping. There's evidence that Epstein-Barr, mono, cytomegalovirus, Lyme's, and chronic fatigue syndrome all have clotting disorders involved. Here we have patient number 1. This patient had a root canal on number 31 that was extracted after a cavitat image was done. They were placed on a proteolytic enzyme regime of TPP protease, 2 pills, 3 times a day, 2 hours after each meal. This is the same patient at week 6, and you can see that we've got more green. Then we look at this patient at week 12. The image is after 12 weeks of therapy. The therapy is now switched to nattokinase, 432 milligrams a day in 3 divided doses. This is patient number 1 after week 16. The therapy was switched from protokinase for an additional 4 weeks, and then this image was taken. Comparison of at the 0 to 6 to 12 to 16 mark shows that we do have less red, more green, and this person did not undergo additional surgery. Here we have patient number 2 on the first day that we see this individual. And we start to note that there's an extraction site on the area of number 17 that doesn't appear to have sound bouncing off of that area of the jaw that gives us the impression there's a cavitation there. This particular person was placed on 4 weeks of protease therapy, 2 pills between meals 3 times a day, again taken 2 hours after a meal or an hour before a meal. And this was the same patient 9 weeks later. This image was taken after an additional 5 weeks of a combined therapy of protease and nattokinase together. So we decided that we would try a little bump with the nattokinase. And if we look at all 3 compared, here we're able to see day 0, week 4, and week 9. So it gives us the impression that we're able to fill in some area that gave us the impression at first that there was there was ischemia in this particular area. So what does this mean? Well, after a stroke, the damaged brain is not surgically excised. After an MI or heart attack, the infarction is not removed surgically. We have easier access to remove dead bone in a jaw. After a clean out, shouldn't we consider natural approaches to reduce further ischemia? We have heard that many of these areas are due to an outflow problem, bone marrow edema. Asthma is an example of an outflow problem. Part of the remedy is thinning the mucus. In jawbone ischemia, we would be attempting to thin the blood. Could small lesions be treated? How long does the therapy last? What are ideal therapeutic dosage? These are all questions that are still unanswered. What are the maintenance doses for these patients? There is another option to consider, neural therapy for the ganglion involved. Have you ever moved your garbage can and then because you were so used to where it was, you threw the trash on the floor? Sometimes the body is so used to sending stuff to the same dump, and in this case it would be maybe a cavitation in a wisdom tooth site or a retromolar area, that it needs that message erased, that this is where you need to send those items. And in that case, neural therapy would be done. That could be an injection done in the particular ganglia involved just to kind of erase the memory that that was a good place to send it. Well, that's the end of this session. If you'd like to email me, my email is drdawn@drdawn.net. You can tell me what you thought about this module. You can send me information about some modules that you would like to hear for future, or if you have an idea of something you would like to do to add to these. I'm always open. Thanks so much.